2018 has been a tough year in the health sector in Africa and Nigeria in particular. One major worrisome incident was a report on the abuse of cough syrups, which contains codeine, which overtook tramadol as the most abused opiate in Nigeria, with 3 million bottles drunk every day in the north of Nigeria alone. Following this ordeal, the Joint Health Sector Unions and Association of Health Workers, except doctors, embarked on over a 1-month strike. This obviously shook the already ailing health system in Nigeria, and to worsen the situation, there were reports by the Socio-Economic Rights and Accountability Project on humanitarian crisis, with corruption and mismanagement at government-run hospitals, and a further report of over 50% of Nigerian trained medical doctors which are currently practicing abroad.
When you go to different health centers, you don't have doctors, sometimes you have doctors. Those are the problem. They should employ more health workers in order to solve this problem. The infrastructure. You don't go to hospital, you don't have syringe, there are no glove. How can you work?
I'm a Nigerian medical doctor. I've been practicing for the last 5 years. I practiced for 4 years in Nigeria and practiced the last 1 year here in the United Kingdom. Medical practice in Nigeria was tough. It was good. It was nice because we had to read. I mean, we had to do lots of work, but that's the thing. I did a lot of work, but I didn't get the fulfillment that I was looking for. And I'm talking about financially, but not just that. I had patients come to me whom I genuinely wanted to help, whom I genuinely had the knowledge to help, but I had no resource to help them. And I watched people die of silly things, I would say.
Another wave that hit the health sector were disease outbreaks, with the first being the Ebola outbreak in Democratic Republic of Congo, with over 500 confirmed cases and 278 confirmed deaths. Following this was a Lassa fever outbreak that spread to 18 states of Nigeria, the largest outbreak ever recorded, with 1,081 suspected cases and 90 recorded deaths. Next to that was the largest cholera outbreak in 20 states in Nigeria, in states like Adamawa, Gombe, Katsina, with over 42,000 reported cases and 830 deaths. This didn't stop here. There were also cases of diarrhea in 10 communities in Borno, with over 1,068 persons affected, and then the yellow fever outbreak currently active in 14 states in Nigeria, with over 1,600 suspected cases. In response to these outbreaks, and in strengthening the health security of Nigeria, the National Center for Disease Control inaugurated an operational National Reference Laboratory and an Incident Coordination Center, which is to serve as an emergency operations center during outbreaks.
The biggest development post-Ebola was the setting up of the Nigeria Center for Disease Control. So the process had already started, but it was after that Ebola outbreak that everyone recognized why it's important to have a center that has the expertise, resources, capabilities to guide our response so that we're not responding in an ad hoc reactionary way. So there are people that are analyzing the data, making decisions, deciding on where to deploy resources, what to put in warehouses, how to keep vaccines, reagents, whatever we need to respond. So that has really created a hub in Abuja with these resources. Now, our work actually happens all the time. We've responded 34 times this year to different small clusters of cases in the states. No one hears about this, but this is how we like our work. We really don't want a big outbreak, because when a big outbreak happens, it means that we have failed somewhere along the line.
Looking at the recent reports that over 20 million Nigerians are living with viral hepatitis, 2018 had seen various awareness campaigns for hepatitis B and C, diabetes, and cancer, as there was a major spike in these cases. This, however, begs the question of how many people are aware of their health status and do routine medical checks.
Hepatitis A and E are usually transmitted through fecal-oral means, so meaning so it gets into your digestive system, and that's how you pick up hepatitis A and E. Now for B, C, D, they're usually caused by blood and blood products. So really worry much about the ones that are transmitted through blood and blood products because of the nature of the viruses, of the nature of the illness, and how it runs, because we found out that those hepatitis B, C, they can lead to liver cancers.
Cancers, simply put, is abnormal growth. We like to encourage women to do self-breast examination, even without any risk factor or any indication for it. It's advisable to regularly check for lumps in your breast.
I'm a proud member of OMP 21, and obviously we decided as a group to sponsor a CSR where we bring awareness to female breast cancer and the fact that most black women or most African women older than 40 are not aware of their body. They don't pay attention to lumps under their breast.
When it comes to universal health coverage, Nigeria ranks low, as only 4% of the population gain access to quality health care without facing financial hardship.
When the NHIS was set up, really the odds were stacked against success. However, they were given the mandate, the NHIS, to encourage the adoption at state level of state-supported health insurance schemes. So in other words, in addition to doing whatever they're doing in terms of implementing health insurance, they should encourage states to set up their own. And this is where I feel the NHIS has not really grasped that challenge. They're still mainly focusing on doing theirs and then assisting states here and there. So if you want to measure their success, look at how many states have state-supported health insurance scheme.
Lagos State, in response to this, has recently launched the Lagos State Health Insurance Scheme. So, as we count down to the end of the year, and although the 2019 healthcare budget presented by the President still falls short of the pledge of African Union leaders to commit at least 50% of their annual budgets, it has not totally been all gloom, as there are little victories worth celebrating, such as the launch of the Patient's Bill of Rights, which identifies rights and privileges in a patient-caregiver relationship for the protection of all parties and to promote higher healthcare standards. And of course, the launch of the National Action Plan for Health 2018 to 2022, as well as other healthcare policies to better improve the health and well-being of Nigerians. Susan Jasper, Plus TV Africa.